So I'm sure that you guys have questions, and I'd like to capture them. I just want to stay true to time because I know that your time is valuable. Please do write questions, put for Michelle, and I will make sure that she gets them. Please include your email address so that we can continue our conversation. Our next speaker is named Mario Anglada. He leads the Enterprises Healthcare Services Division at Univision Communications. And he's going to be talking to you today about some products and offerings that we have that are incredibly unique and that are actually driving and can drive cost containment for health systems. I'm very excited for him to get on the mic and tell you guys more about this in depth. Thank you. Mario.
So thank you, Missy, and thank you everybody for the time this morning. As Missy mentioned, what we do on our enterprises team is we understand that there's a lot of good data available that can be provided by people like Carlos and his team. We also understand that there is a little bit of a disconnect between information, how do I engage with the Hispanic consumer, and what should I do? So what our team does is we focus on dimensionalizing that and making a product or a service that addresses that need for the Hispanic consumer. And we'll talk about how we've built these and what these can mean for the Hispanic community as a whole and for you as an institutional entity. So the first program that we launched 4 years ago was Univision Farmacia. Univision Farmacia is a completely free medical discount card. So it's 100% free. It includes every single FDA-approved drug in the US. We did that because we wanted our consumers to get a tangible product into their hands. They get a plastic card that is delivered through the mail to their home. We imprint their name, the family's name, and this card then, with a valid prescription, is taken to any of 65,000 pharmacies across the US to purchase medications. We discount the price of those cash pay transactions up to 85% in certain cases, at a minimum 20% discount, but it's important that what we bring to the consumer is a valuable free service that we've used for other purposes. The other purposes being the development of a database to be able to communicate with that consumer longer term. So to date, we have 2.3 million Farmacia members. We've processed over 3 million pharmacy transactions. We've saved them over $69 million. We do this in conjunction with other partners. As an example, in the Sinai Health System in Chicago, every single patient that goes into a clinic is offered a Farmacia card. That is a tangible benefit that that member gets. It allows us to associate with the Sinai brand and their patient base, and we cover all the costs associated to that. So in that scenario, the members get an Univision Farmacia Sinai Health co-branded card. What's important here is that we do this with a variety of healthcare stakeholders. We do this with unions. We do this with the Autism Speak Society. We've done this with the Mexican consulates. What have we achieved? A database of about 2.3 million people, 1 million addresses. We have 1.5 million emails and over 700,000 SMS numbers that we utilize for monthly communication. Here, we send out health literacy. We provide information on particular relevant subjects that our community are interested in. We also make sure that partner communications are transmitted to our membership. This is a completely national program that applies to all of the US and Puerto Rico, so we can segment our database to the level of a city, or we can do it at a national scale. So Farmacia is our starting point. Farmacia took us to our next foray into a deeper relationship with consumers, and this is called Uniconsulta. Uniconsulta is the first Hispanic-focused telehealth program in the US. Our program is a little bit different from what is offered in the general market. We offer a subscriptive-based telemedicine approach. Consumers in a group of 5 people have access to board-certified physicians that are bilingual. They provide care 24 hours, 7 days a week across all of the US with 2 exceptions. So Washington State and Arkansas, where telemedicine is still not permitted. Everywhere else, we're available today. This allows consumers to share 5 primary care visits with their chosen 5 groups. It could be 5 family members, or it could be 5 employees at a cafeteria. And we made it in that manner because we wanted to be available to all socioeconomic groups, independent of their ability to pay our monthly premium. That premium entitles the consumer to 5 consults every month with board-certified physicians, 24/7. Our average wait time is 17 minutes, and our typical consults are about 22 minutes. And this is all primary care oriented. We also allow consumers to have access to a platform for email that gives them access to doctors, dentists, psychologists, and pharmacists. So if you want to ask any question of those healthcare professionals, an answer will come back to you within 2 to 4 hours in language of your choice. Everything that I've described so far and into the future is completely bilingual. So we've created it in Spanish, but it's also available to non-Spanish speaking members. So what do? They get these two products. In the third element is a wellness center where you do diagnostic risk assessments to determine your risk for diabetes and other conditions. You have a full medical library, and you have the ability to create personalized weight loss or strength training programs. Again, this is all offered to a family of 5 for $29.99 every month. Chronic condition management programs are something that we've been focused on for the past couple of years. Here's an example of something that we did with Montefiore in the Bronx. In this scenario, we partnered 8 companies. We had Novo Nordisk, Bayer Pharmaceuticals, we had the YMCA, CVS, Montefiore, Inquisit Health, and other partners come together to create a particular engagement around diabetes. We did an event where we had consumers come in, learn about the condition, be tested, and we provided them, once they knew their status, pathways. The pathway that we're focusing here is on the third of the 3 groups that we segmented. First were pre-diabetics, diabetics, and then diabetics that were deemed uncontrolled with an A1C of over 9. In that group, we then engaged with them for a 6-month follow-on period, and the results are the ones that you see here. We were able to reduce their A1C by 1.95% as a group, and we were able to graduate 95% of our participants in this 6-month engagement. And that only covered the element of peer mentoring, which you see here at the bottom. Our next phase is to provide a complete ecosystem to consumers that gives them medication, telemedicine, their testing supplies, and all the peripherals, and do that at a significant discount of what is available today. The typical cost for a diabetic is $13,700 across the US. And in our model, the consumer will get a fully functional kit that has all the peripherals, all their medications, and everything is delivered and set up at their home for them. We do then remote patient engagement and monitoring, and we don't provide that service. We partner with institutions. The institutions put their clinical protocols. What we do is we provide the engagement for the consumers, the onboarding, and the support that that patient needs to be in our platform. Everything is captured in a HIPAA-compliant, high-tech compliant manner, and it's transmitted back to our institutional partners. Our cost per member per year is starting at $1,500 for a diabetic, and that's about a 90% reduction on cost. As you see here, it's a complete ecosystem that we're bringing to the table, and what we are interested in doing is making this customizable to all our partners. So we don't want to be in the space of being able to provide healthcare. What we want to do is to provide an ecosystem and a platform that can truly engage the Hispanic consumer in their care and navigate that journey with the patient, holding his or her hand through the system. And that's what we're offering for our partners. Today we have diabetes. We're working on hypertension, asthma, and obesity. And lastly, our next product is a direct-to-consumer sales of medications. So we are going to provide access to the 3,200 most common generics available to consumers in a very simple to understand model. $10, $15, or $20 will provide each of them 30-day supplies of these medications. So on the low side, you're paying for 5 medications $50. On the high side, about $100. These medications represent 70% of the generics volume in the US. What's important is we don't change the consumer behavior. What the consumer gets is a voucher. That voucher is redeemable with a valid prescription at any of 67,000 pharmacies across the US. So again, our goal here is to facilitate the transaction and take some of the friction that the consumer is experiencing in the healthcare system today, and using our ability to engage with that consumer, craft turnkey solutions for them and for our partner institutional collaborators. That's it. So thank you.